USMLE style question. A 68-year-old man with a history of hypertension and hyperlipidemia presents with painless subacute vision loss in the superior visual field of his right eye. Fundoscopic examination reveals dilated and tortuous retinal veins, retinal hemorrhages, and cotton wool spots localized to the inferior retina. Which of the following is the most likely underlying pathophysiologic mechanism in this patient? A. Embolism from the internal carotid artery. B. Thrombosis in the central retinal vein at the lamina cribrosa. C. Compression of a retinal vein by a sclerotic arteriole. D. Arterial thrombosis due to giant cell arteritis. E. Optic nerve demyelination. Answer and explanation. Correct answer. C. Compression of a retinal vein by a sclerotic arteriole. The patient's presentation is consistent with branch retinal vein occlusion, BRVO, which occurs due to secondary thrombosis at an arteriovenous crossing, where a sclerotic arteriole compresses the adjacent venule. BRVO typically affects a localized retinal area, in contrast to central retinal vein occlusion, CRVO, which involves the entire retina. The location of retinal hemorrhages and ischemia corresponds to the affected venous drainage region, e.g., inferior retinal findings, superior visual field defect. Risk factors: hypertension, atherosclerosis, diabetes, and hypercoagulable states. Incorrect choices: A. Embolism from the internal carotid artery, more likely to cause retinal artery occlusion, presenting with a cherry red spot and a pale retina. B. Thrombosis in the central retinal vein at the lamina cribrosa, seen in central retinal vein occlusion, CRVO, which affects the entire retina, not just a localized branch. D. Arterial thrombosis due to giant cell arteritis would cause retinal artery occlusion, not venous occlusion, and may be associated with jaw claudication, scalp tenderness, and an elevated ESR-CRP. E. Optic nerve demyelination, suggestive of optic neuritis, seen in conditions like multiple sclerosis, which presents with painful vision loss and an afferent pupillary defect. Would you like another